Just wondering if you could perhaps just chat to me a little bit about why you think the time is now for a change of focus for housing associations and other institutions.
I think if you take the historical origins of housing associations, they were constructed of the 19th century
Yeah.
when there was no municipalisation, responding to the poor laws. And we came about because there was a period of national social crisis. And if you take the sort of the mass growth of associations in the 60s and 70s after Cathy came home, what we saw then was a phenomenal rise of the housing association movement, again born out of a national crisis. Then we had the sort of late 80s, early 90s inner city disturbances, which led to formation of specialist associations. So if you wind the clock forward to the 2020s, we are in a period of sustained national social crisis. So my argument is that housing associations are primed for historical reasons and are really well placed to respond on a much wider level.
In terms of Hafod and your housing association, then, how have you been changing your association to try to work more closely with people in your homes to improve their health and well-being? What have been some of the practical things you've been doing or are planning to do?
So one of the first things we did nearly 6 years ago was move away from the traditional housing officer model. And I think what we've got across Wales, the UK, is a broad spectrum of the relational model. I think very few associations these days do the pure, just old housing officers you and I would have done 100 years ago. It's very much today based on this idea that it's about understanding the requirements of the person. We moved to a relational model. We were unique. Notting Hill, Bromford, we're pioneers in this. And there have been various iterations of the relational model. But I would say that given COVID, given the cost of living, the energy crisis, and general austerity, the pressure now felt on that front line by coaches looks very different to what it did even 5 or 6 years ago. We've quantified that in rough terms, 30 to 40% of the frontline time is being used to work with people in distress, in crisis. We get more and more involved in multi-agency referrals, more and more involved in the pseudo social worker, the pseudo probation officer, the pseudo school teacher, the pseudo everything that really encompasses, I think, the broader evolution, but partly by design and partly by default, on how we as a sector, particularly since 2010 and the welfare reform changes, and we were on this road even before this, we've really stepped up into this vacuum of pseudo-state actors.
Yeah, partly out of necessity, I guess, but also partly just because of the perspective and view of your organisation that that's the right thing to do. But what would be also good to understand a little bit, and I think particularly for the audience at our conference today, is so there's something about the things we can control within our own organisations, if you like, so we can change our business models, and every organisation represented here today can do that. But I think what's been critical to your journey has been the work also externally with partners and with other organisations who the bedrock of our community. And at 2025, we focused an awful lot around systems leadership and looking at kind of how we can collaborate better in communities and how, no matter who we are, what level we work at, how we can take a leadership role in doing the right things in our community. So just be interested to understand a little bit about not only the work you've done, a kind of, I guess, around reshaping your own organisation and what matters to you, but how have you started to build some of those broader networks and relationships with the key actors in your local areas?
I think probably first, Claire, it's about building a narrative, and a narrative that I think is constructed on the reality. And I think for me, the hard yards in the last couple of years have been to build and craft a narrative that starts to reflect the reality. And that reality is that we are de facto state actors, and we have been plugging. It's the sort of boy that's got the finger in the dams, sort of scenario, in that despite the tide,
Yeah.
we're in there. There's no question of retreat, because we have to recognise we're part of a broader ecosystem. So I suppose the last few years have been doing the rounds, building those networks, having conversations, particularly with not your usual suspects. And I think health is a really interesting question, because certainly my experience in England, one of the things that taught me about engaging with health was they have a certain perception of you as a housing person walking into the room, and that is you're land grabbing, you're after their money. So you have to afford people the respect to learn to speak their language, not your language.
Yeah.
You have to understand what their key drivers are. So some of the wordy work we've done has been around exploring hospital discharge.
Yeah.
So as we move as a country in policy terms away from residential provision and into communities. So take housing associations, we've got thousands of homes. We've got people in various levels of care need. So we're a really organic capture and a network where you can start to build out that offer. Where you've got the basis of trust and confidence anyway, because outside of the postman or woman, you're probably next important institution in people's lives, and certainly many people's lives. We've got a keen understanding of people's needs beyond housing. And again, as part of the work I've been doing with colleagues in Welsh Government around trying to grow that organic offer, and that involves a redesign of our offering beyond housing management to include people's health and well-being. I think that's probably been another important factor in this, Claire.
That's I think that's really thought provoking, especially as we're going to move into our sessions this afternoon at the conference, where we're going to be starting to talk quite practically about what we might want to do together, how we might start to build some stronger alliances. Because you're right that when we work with other agencies, we often talk a different language, but when we break down some of those barriers and start to understand who different public sector organisations or third sector organisations are working within communities, we are all working with the same people, but we sometimes just work with the same people in wholly separate and distinct ways. And if we can harbour our resources and our energies and our commitments together, then I think we can start to build up from, I guess, some really good pockets of fantastic practice that's going on in communities, but that's often hidden or not seen. And maybe we all keep reinventing the wheel. And one of the reasons I'm really pleased to have you here today is because you're sharing with us some of the perspectives from South Wales. And sometimes we can think we have to invent everything ourselves up in North Wales. And I'm hopeful that from today's event, we're going to start to build not only stronger collaborations in North Wales, but that we also start to network better with colleagues and organisations who are working all over our country, so that we can really start to build on some of the great practices that are going on. And I know there are certainly lots of examples of that from your organisation. So really good to have you here today. And I just wonder whether there's any final thought that you'd like to leave with us as we break for lunch, and then we're going to move into our practical session this afternoon. So yours will be the final words people will have in their thoughts and minds as they close to eat a sandwich in a few minutes.
A thought for this afternoon is that in times of crisis, in order to stay relevant, one has to reinvent. The opportunity affords us. We need to look to leadership within and not necessarily for directives. And so if somebody was to ask me, in an ideal world, what would the sector look like in 5 or 10 years' time? I would say it would resemble what they call multiple service organisations, successful in large parts of the United States, supported by federal government, in pockets of Europe, parts of Australia. So multi-service organisations are receptive to an infrastructure where silo funding is removed and silo working, and it's impacting now across departmental responsibilities. So some of the work that we've crafted within Hafod is to create an internal architecture, because as an organisation, to respond to an MSO proposition, the first thing you have to clear is the internal architecture in your organisation fit for purpose.
Yeah.
I think once you get past that, then I think there is a really strong groundswell of opinion that's moving in that direction in Wales and elsewhere. And I think that is the real moment. And for me, that's what would characterise the future of the sector.